Chapter 16, Emergency Childbirth. Childbirth is a normal part, natural part of life. Your part in the process involves helping, guiding, and supporting the newborn as it's born. After the birth, you should ensure that the newborn is breathing adequately and being kept warm. Two indicators of impending birth are the frequency of contractions and crowning. The first stage of labor in a pregnant woman's body prepares for birth, characterized by these conditions: initial contractions, breaking of the waters, the bloody show, and the newborn's head does not appear during these contractions. That would be crowning. That would be the second part of labor. Second part of stage of labor, with the newborn, birth of the newborn, you will see the newborn's head crowning during the contractions. There is no time for transport to hospital at this point in time. Third stage would be the delivery of the placenta, in which case you must assist the mother and the newborn in delivering the placenta. Is there time to reach the hospital? First thing you need to ask is this your first pregnancy? A woman experiencing her first labor will usually have more time to reach the hospital. Usually takes 6-12 hours maybe, and then you know that the baby will be born. And has the woman experienced a bloody show, or has the waters broken? Usually the amniotic fluid will break and come out, indicating that birthing is imminent. Okay. When the contractions are less than 2 minutes apart, this usually indicates that the delivery will occur very soon. Does the woman have a feeling that she needs to go to the loo to move her bowels? When the newborn's head is in the birth canal, it presses against the rectum. Do not allow her to go to the toilet at this point in time. You don't want the baby to be born in the toilet. Okay, if the newborn's head is crowning, there is not really any time to get to hospital. The best you can do is find out how far the ambulance is. You must remember, in some places there's bad weather, there's natural disasters, traffic, South Africa, load shedding and traffic, things like that. Okay, that all influences how long the ambulance is going to take to get to you. The time the contraction cycles from beginning of one contraction to the beginning of the next. Okay, if they're less than 3 minutes apart, delivery will be very close. Observe the vaginal opening during this contraction. If you see the head crowning during a contraction, prepare for delivery. Do not take the risk of transporting the woman to hospital. Okay, as you prepare to assist the delivery, two things you must keep in mind: keep the woman calm. Delivery is a natural process, and obviously keep yourself calm. You're just there to help. All right, you will not be able to maintain sterile conditions. Attempt to be as clean as possible. Wash your hands thoroughly. If you do not have sterile delivery kit, use gloves from an EMR life support kit. Have plenty of clean towels handy. Place the patient on a firm surface that is padded with blankets, folded sheets, towels, anything like that. Elevate the woman's hips 2 to 4 inches with pillows or blankets. Place the woman on her back, knees bent, feet flat on the surface beneath her. Okay. A woman in childbirth will expel both blood and bodily fluids. Use sterile gloves wherever possible. Okay, you may need to have face protection or eye protection during this time. Wearing a surgical gown can help you to keep body fluids off you. Okay, emergency care equipment should include a pre-packed obstetric delivery kit, sterile gloves, umbilical cord clamps, things like that. Baby kit consists of sterile drapes and towels, a sanitary pad, gauze, towels and blankets for the newborn, bulb syringe to clean the baby's mouth out with any possible fluids, and a plastic bag for the placenta. Doesn't help harm to have a space blanket there as well to keep the baby warm once it is born. You'll also be needing some sheets, suction. That's what we're going to use the bulb syringe for. Oxygen may be necessary, a small one, but it's not always essential. If you don't have a delivery kit, look for appropriate substitute materials. Lots of warm water, lots of clean towels, cheats, things like that. There are two lives to be considered at this point in time, the life of the mother and the life of the newborn. Do not neglect to perform a patient assessment on the woman. Remember, primary survey, secondary survey. Okay, your primary purpose is to assist with the delivery of the newborn. Be as clean as possible during the entire delivery process. All right, the newborn's head should emerge slowly to prevent undue stress on the newborn and tearing of the vaginal tissues. As the head emerges, support the head and tell the woman to stop pushing. Do not attempt to pull the newborn during the delivery. Okay, when it's a normal birth, the newborn will turn to its side by itself after the head emerges. The rest of the body will be delivered spontaneously. Remember, newborn will be slippery and wet. Keep the newborn's head about level with the woman's vagina. Or let's check at this point to see if there is any umbilical cord wrapped around the baby's head at any time. If it is, try and remove it. You see by the pictures of stages of delivery. Slide A, crowning. Slide B, burst. Slide C, baby's head turns naturally to the side. And slide D, the circular delivery of the lower shoulder. Okay, if this amniotic sac is not broken, tear it with your fingers or push it away from the newborn's head and mouth. If the umbilical cord is wrapped around the neck, attempt to slip it over the head. If you cannot disentangle the newborn, attempt to reduce the blood pressure on the cord. Never pull on the umbilical cord. Okay. If the umbilical cord, you can't get it off there, we'll look at it just now. Clear the baby's mouth and nose using a bulb syringe if it's available. Suction first the mouth and then the nostrils 2 or 3 times until they are clear. Remember, babies can't breathe through their mouth. They can only breathe through their nose. So they must make sure the mouth is clean before you clean the nostrils out. If a bulb syringe is not available, wipe the mouth and nose with a gauze pad. Place the newborn on the mother's abdomen to keep it warm and prevent from losing warmth. Babies get cold very quickly once they've been delivered. There we go, a picture of suctioning the mouth and nose to clear the mucus and amniotic fluid from the baby's mouth and nose. All right, if the baby is not breathing, suction the mouth, suction again the nose. Rub the newborn's baby's back, flick the soles under the feet to stimulate breathing. Use a towel to dry the newborn and wrap him or her in the blanket and keep him or her warm. Place the newborn on its side with its head slightly lower than the trunk. When the umbilical cord stops pulsating, clamp it, and with the umbilical cord clamps or tie it with gauze. Note the time of the delivery. If there's multiple births, prepare for a second delivery. Delivery of the placenta. The placenta usually delivers on its own within 30 minutes after the delivery. Never pull on the umbilical cord. Leave the umbilical cord uncut and attach to the placenta until the EMS arrives. Okay, after the placenta is delivered, wrap it in a towel or newspaper with 3/4 of the umbilical cord in there. Place it in a plastic bag and transport it to the hospital. Keep the baby at the same level as the placenta if possible. Okay. Mother's bleeding usually stops after the placenta is delivered. If it does not, massage the uterus. Place one hand above the mother's pubic bone and use the hand to press down firmly on the abdomen. Using circular motions, massage the uterus until it becomes firm. It should take 3 to 5 minutes. You will feel it if you place your hand on the belly, below the belly button, above the pubic bone. It's like an upside down soup dish. Okay, and as you stimulate, as you rub it, so it starts to contract, thus stopping the bleeding from the uterus and causing the placenta to be dispelled. The placenta needs to come out whole, otherwise further surgical intervention will be needed. Okay, so gently rub firmly and don't forget to ask permission before you do anything. Okay, after the care for mother and newborn, continue to observe the mother and the newborn, keep them warm. Okay, it actually helps if the newborn is firmly against the mommy. Every 3 to 5 minutes, check for the uterus firmness and check for excessive vaginal bleeding. Normal delivery, the mother would lose between 300 and 500 ml of blood, 1 to 2 cups. Okay, that's quite normal. Obviously, if there's excessive bleeding and things like that, arrange rapid transport and give oxygen, high flow rate. Continue to massage the uterus until it stops bleeding. Clean the mother as clean as possible. Moist, warm cloths will help. Give small amounts of water to drink if she's thirsty. Remember, nausea and shock. Don't let us drink if she's not conscious and of capable to control vomiting and things like that. If the newborn does not breathe on its own in the first minute after birth, proceed with steps 2, CPR. Okay, in ectopic pregnancies and shock in pregnancies, ectopic pregnancy occurs when a fertilized egg becomes implanted in the fallopian tubes. Obviously, it's way too small for a uterus to grow, for the fetus to grow. So it will cause exceptional pain, rupture, and possible major bleeding and things like that. Ectopic pregnancy and shock in pregnancy. This rupture causes acute abdominal pain, like I said, internal bleeding, and could lead to shock, hypovolemic shock. Treat the patient for shock. Remember, ABCs. If airway, breathing, circulation has failed in any way, prepare to do CPR. Arrange rapid prompt transport to the hospital. Miscarriage and vaginal bleeding. A miscarriage is a spontaneous abortion and is delivered of an incomplete or underdeveloped fetus. If a miscarriage occurs, save the fetus and all tissues that pass from the vagina. Control the bleeding as best as possible. Treat for shock and arrange rapid transport to hospital. Right. Further complications with miscarriage and vaginal bleeding. Vaginal bleeding is often one of the first signs of a miscarriage. When the woman experiences vaginal bleeding, they have to perform a patient assessment. Don't forget primary survey, secondary survey, obtain a good medical history, obtain a set of baseline vitals, something you can go back and check constantly, and arrange rapid transport. You may need to provide a bit of emotional support as well. Usually it can become a very emotional situation if the loss of a child. Prem-born babies, anything under 2 kilos, delivered before 36 is considered to be premature. Prem newborns are smaller, thinner, and usually redder than full-term babies. Okay, it's important to keep the premature newborns warm because they lose heat very rapidly. Just remember, they also don't have a lot of fat around their bodies and things like that. It's another reason they lose heat. Arrange rapid transport for mama and baby. Keep them warm. Okay, unbroken bags of water. Okay, carefully break the bag, push it away from the baby's mouth so that he or she can breathe. Be careful not to injure the baby in the process. Okay, suctions the baby's mouth and then the nose, helps him or her breathe. It stimulates him to breathe. Okay, don't suction until the baby's out of the birth canal. Okay, prolapse of the umbilical cord. Now this is where the tacky hits the tar, so to say. The cord may become compressed between the newborn and the baby's pelvis during contractions. Place the pregnant baby in a position that raises her hips. Okay, keep the cord covered and moist. Do not try and push it back into the vagina, and arrange rapid, very rapid transport to the hospital. Administer oxygen if you're trained to do so and have it. Okay, some EMS systems recommend placing the woman in a kneeling position to take pressure off the cord. Never a good thing when the cord comes first. Breech positions. Newborn babies come down first into the birth canal rather than the head. Not much you can do to help at this point in time. It's going to take its natural process. Arrange rapid transport. Support the buttocks and legs as they're delivered. Usually the head follows on its own. Once the bum's out the way, the head will follow. Okay, breech birth continued. If, however, the head does not deliver in 3 minutes, arrange for rapid transport. Insert a gloved hand into the vagina and use the fingers to keep the newborn's airway open. In rare cases, an arm or a leg may be produced first. Limb presentation cannot be handled in the field. Okay, absolutely not. You've got to get to the hospital quickly. Occasionally, sometimes a newborn dies in uterus before delivery. The fetus will generally have an unpleasant odor and will not exhibit any signs of life. Carefully wrap the stillborn in a blanket. Turn your attention and provide physical care and emotional support for the mother. Multiple births, yippee! Another set of labor contractions will begin shortly after the first delivery. Get ready to repeat the procedure you completed for the first delivery. Excessive bleeding, remember, approximately 1 to 2 cups of blood. It can be lost during childbirth. Anything else is a definite cause for concern. All right. If the mother is bleeding severely, place 1 or more clean sanitary pads at the opening of the vagina. Elevate her legs and hips and treat for shock. Only thing that we have to have is rapid transport to hospital. It's a very serious condition. Excessive bleeding after delivery, encourage the newborn to nurse at the mother's breast. You must remember that nursing babies encourage the stimulation of oxytocin. Oxytocin helps to shrink the uterus, prevent bleeding, excessive bleeding. Continue to massage the mother's uterus with your hand. The area between the vagina and the anus may be torn. Treat it as an open wound. You could pack it if it's excessively large with a wet dressing. Otherwise, encourage the mother to keep her legs closed tight. Try and stop bleeding in that way. All right. Must remember, forces involved, even a minor crash can hurt or greatly injure the woman and the unborn baby. Promptly assess the patient, arrange for rapid transport to hospital. The woman must be examined by a physician. The woman exhibits any signs of shock. Monitor the airway, breathing, circulation, arrange for administration of oxygen. A high flow rate, 10 to 15 liters per minute on a non-rebreathable mask, and have the woman lie on the left side rather than on her back. In rare cases, a crash can be severe enough to kill a pregnant lady, but not the fetus. Provide CPR to a woman while being transported to the closest medical facility. Thank you.